IVM.
Welcome to All Things Policy, a daily podcast by the Takshashila Institution. We are a bunch of policy nerds based in Bengaluru, and we like bringing fresh perspectives to Indian affairs and Indian perspectives to global affairs. So grab a cup of coffee, sit back, and join us for today's chat.
Hello and welcome to All Things Policy. I am Sunila and today I have with me Shambhavi and we are going to be talking about vaccination updates. So it has been exactly a month since the COVID-19 vaccination drive started in India, and we will look at how things are looking up in India and what are the updates that have happened globally. So hi Shambhavi.
Hey Sunila, hello everybody.
So today is 17th Feb and we started vaccination for COVID-19 on 16 January. So exactly 30 days ago. And the target group for the first phase of vaccination in India was frontline workers, which includes the healthcare workers, obviously. And moving forward, after that's done, we will be vaccinating the above 50 population who have comorbidities as well. So, Shambhavi, do you want to tell us about the status of COVID-19 vaccination in India? How is it going? How much population we have covered? How much money we have spent on it?
Right. Thanks, Sunila. So India, I think, is currently fourth on the list of countries which have done maximum vaccinations. So the first is the US, then China, then the UK, and then India. Obviously, India has a much bigger population than two of those countries that we mentioned. So we need to be really pushing the pedal here. But hopefully we'll be able to do that over the coming months. Currently, we have vaccinated about 8.4 million people. I am citing data from an article that Anup Puyan has written for India Spend. So we have vaccinated 8.4 million people with either Covaxin or with Covishield. Covaxin is made by Bharat Biotech. Covishield is made by Serum Institute of India and is a tech transfer of the AstraZeneca vaccine. Out of these, only 97,732 have received both the doses. So if you guys remember, to develop immunity, you need to have both the doses and then wait for a certain amount of time. There has been a lot of debate on when the second dose should be administered, and new data is still coming on immunity building. But as of now, we are seeing a lot of people dropping out after getting that first dose, which could be problematic in the long term, particularly in forming immunity for a longer term against COVID-19. Our target is to vaccinate about 300 million people by July. And for that target, we are very slow. So we have just about done 3.4% of the total target, which has received just the first dose. So we really need to ramp up both supply and distribution of the vaccines.
Why do you think people are dropping out after first dose of vaccine? Like, is it just the carelessness, or like we are not doing enough to notify people or remind people? Like, what could be the reason here?
I really don't know. I mean, I don't think it would be carelessness because these are healthcare workers, right? These are people who are routinely exposed to the virus and people who understand vaccinations and people who understand the significance of the second dose. So I really don't know why people are dropping out. We need to figure that one out, because if our healthcare population starts dropping out, then I expect those numbers to go up when we move to a more general population. There were obviously issues with scheduling and stuff like that when we started off with the vaccination drive. We know in some states the COVID app, which is the app that causes that aids registration and scheduling, had glitches in it. We don't know how much of that might have contributed. I think the simple answer is we don't know.
So, speaking of COVID app, I mean, recently I read somewhere in news that there were some technical glitches in Maharashtra, and that like only 25% of the recipients eligible for the second dose could get the shot, while hundreds had to be turned away without vaccination. So, for a country like India, what are the implications of technical glitches happening in the COVID-19 vaccination drive? I mean, we know India as a huge population, and like having technical glitches an app meant for coordinating the logistical challenges of this drive can have serious implications, right?
Yeah, I think for a lot of states, we quickly moved to older forms of maintaining registries. And I don't see why that is something we cannot just do in addition to the COVID app. So have like a vaccination card. And I think a lot of people are doing that. So with that, your conflicts and confusion should really go down. It's a user-based system, so then you have to see your card and remember when to go, unlike getting a message. But over dependence on technology by itself might not also be very helpful in the Indian context. But again, we are looking at a very specific population here of healthcare workers. So I really don't know how much glitches in technology might have contributed to the lack of people turning up for the second dose.
Hmm. Like about a month ago, the Ken had carried an article about COVID, and they were talking about the same thing, like the technical glitches. Apparently, the healthcare workers, they were receiving messages from the COVID app saying that, their the vaccination is cancelled for that day, and then they were not informed when to come on some other day. So they ended up going back to writing their name on the paper by pen. So, like, I don't know, like the reason for which we have developed COVID app may not be serving its purpose, I feel.
I mean, okay, it's a technology is bound to have glitches. We were supposed to have dry runs in which these glitches should have been caught. Very likely it's not scaling up in capacity to the demand, and means that we need to work better on it. But again, I really hope that that is not the main reason why people are not turning up for vaccine.
Yeah, let's hope that. So when we are speaking of COVID-19 vaccination, we have to talk about adverse events as well. So how many adverse events have been reported till now in India?
So adverse events, I think we are looking at about somewhere between 8,000 and 9,000 adverse events until the first week of February. There are about 35 that required hospitalization, 28 that died. But again, none of these have been actually, rather the government has said that none of these have been related to the vaccine. So we really don't know. We'll have to wait for the investigations to be done to figure out how many of these adverse events were caused by people taking the vaccine. So we have to wait and figure that one out.
Yeah. So one thing I want to make it clear, like these adverse events, they do not necessarily mean that they were correlated to COVID-19 vaccine, or like there was any causal relationship. They might be completely unrelated. So like this should not lead to loss of confidence in the vaccine, right?
Yeah, and the point here is that our current surveillance system for adverse events is set up to look at mostly allergic reactions within the first 30 minutes of getting the vaccine. So the protocol for getting the vaccine is that you get the vaccine and you wait in the center for 30 minutes to see if you develop an allergic reaction. Medical assistance is on standby at all booths in case someone does require emergency interventions. And then you go home. So a lot of the serious adverse events, the safety signals that we're looking for is anaphylaxis. We have probably, for Pfizer and Moderna, we have seen incidents of those in other countries, but I don't think we have seen anything significant in India yet that we know of.
Right. So moving on, there's some news that India may approve one more vaccine. Do you want to talk about which vaccine is that? And if we have any details about that?
We are doing clinical trials for a lot of the vaccines. I think Sputnik 5 is the next vaccine which is coming to a close on. I think they've submitted their interim data, and they're probably at a similar stage with a similar sort of data that maybe Bharat Biotech had when Covaxin got approved. I really don't know a lot of the details, but Since we have set a precedent that phase 1 and phase 2 data might be enough to get approvals of at least in the clinical trial mode under emergency, rather under the fast track accelerated approval scheme. And we are clearly falling short of our distribution targets. We might see Sputnik 5 being approved, but we'll have to wait and see how that plays out.
Yeah. From what I remember, I read that, at least 26 countries have approved Sputnik 5 for use, and markets in Brazil and India are actually close to authorizing it. Also, there was some study that was published in Lancet that showed that vaccine has 91.6% success rate. So, looks like a huge number for success rate. So, let's hope that vaccine is actually effective.
Yeah, I mean, there now we are seeing two very different challenges in interpreting efficacy to approval. A is the clinical trial design itself. So, for example, if you're looking only at severe cases of COVID-19, and like for example, the Pfizer and Moderna initially looked only for severe or moderate to severe cases, and they found that it was really effective in preventing those, but they haven't looked at asymptomatic transmission. Whereas the Sinovac, which was one of the Chinese vaccines when it was tried in Brazil, they looked at asymptomatic, mild, moderate, and severe form of disease, and they found that in the case of severe disease, it was in the higher 90s, the efficacy of the vaccine. But when it came to asymptomatic, it was lesser, and therefore the overall vaccine efficacy was at 51%. So how do you determine, what is the purpose of vaccinating? Is it just to prevent severe form of the disease? Is it to prevent asymptomatic transmission? And how do we actually use that scientific data to drive policy, something that Indian policymakers have to figure out? The other challenge is the upcoming variants of SARS-CoV-2 and how they might impact the efficacy of the vaccine. So, for example, there have been reports that the AstraZeneca vaccine is not working as effectively against strains found in South Africa. And the Serum Institute had actually sent a lot of doses to South Africa for vaccination. And again, there has been a report that South Africa may have asked Serum Institute to take back 1 million doses because they don't want to use it since it is not very effective on the variant that is found there. So how the incoming variants will play a role in which vaccine is given where. So that's also something that we need to figure out going forward.
And clearly the science of immunity and vaccine is very complex, isn't it? If the vaccine works on asymptomatic cases or if it works only for severe forms of infection, that's a very complex question, and it can affect the whole vaccination process, like the whole logistical part of it as well.
Yeah, I think the purpose of vaccination has to be extremely clear. Are you doing it to say protect your vulnerable population only, right? From the endpoint, which could be mortality, or are you trying to reduce hospitalizations, or are you trying to get herd immunity, right? If you think about it in terms of herd immunity, which is the most often thrown jargon around currently, India is doing a really poor job because we need 70 to 80% of people to have immunity against COVID-19 at a definite point of time, which means 70 to 80% people have to be vaccinated within a very limited time frame.
Yeah.
You can't have one person vaccinated today and one person vaccinated 3 years later, because again, we don't know how long this immunity lasts. So we have to define the purpose of vaccination. I think we have to be very clear on what we are trying to achieve here, so that we can pick the right kind of vaccines for the right kind of people and have channels established to make sure that vaccines are distributed.
Right. So speaking of approval of vaccines, WHO says that the COVAX is like the only true global solution to this pandemic because it will ensure that all over the world people will have access to COVID-19 vaccines once they are available, regardless of their wealth. So this COVAX initiative, it is coordinated by Gavi, the Vaccine Alliance, the Coalition for Epidemic Preparedness Innovations, and the WHO. So what COVAX will do is it will act as a platform that will support the research, development and manufacturing of wide range of COVID-19 vaccine candidates and negotiate their price. So moving on to the vaccines that they have approved, Shambhavi, do you want to tell us which vaccines they have approved recently?
They have approved two versions of the AstraZeneca Oxford vaccine. One is Covishield, which the Serum Institute of India is making, and the other is AstraZeneca SK Bio, which is from the Republic of Korea. But again, we will have to see which countries will actually buy the vaccines, how they'll be utilized, what kind of further trials do we need to do on local variants to see the utility of the vaccines.
Right, right. So the vaccine, if I'm not wrong, was reviewed on 8 February by WHO Strategic Advisory Group of experts on immunization. And they say that they recommended the vaccine for all age groups, 18 and above.
Yeah, but it will be on data that was submitted that they've seen so far. And because these new variants are still coming in, we'll have to figure out.
Right.
We have to figure out actually policy mechanisms to, the monitoring mechanisms to figure out efficacy even in ongoing vaccination programs. So just as a continuation, India has also approved trials for an intranasal vaccine, which could be a real game changer. It's not going to come anytime soon. It's just the first trial. So this is with Bharat Biotech. But whenever it comes in, it would be really good to have it because then you can democratize the vaccine administration process. You don't have to necessarily go to a doctor. That also depends on India opening up private markets for distribution of the vaccine. We are currently in a government control setup. But hopefully that will also happen soon because I think it will be necessary if India wants to reach its targets of vaccinating a majority population that we use all possible channels that we currently have.
So will nasal vaccine be easier to administer?
We expect it to be. And finally, just to hark back to where we were when we started having all these conversations of COVID-19 and vaccinations. Vaccinations is a great way of preventing disease. But even better way is to figure out how this entire incident started of viruses jumping from, like zoonotic viruses jumping from animals to humans, and where COVID-19 came from, to make sure that we have public health measures put in place to prevent any further such incidents. To that end, WHO is on its probe. We know that the team that went to seek the origins of COVID-19 has returned with this preliminary analysis. We have to wait for its reports to come out to comment on it further. But at least the first set of interviews have been done, and further epidemiological studies will now be designed to at least try and figure out how all of this has come to pass.
Right. So, yeah, we will wait for the report to come out. So all the listeners stay tuned because we will be talking about it soon when the report comes out. And while concluding, I would just like to say that India has covered only 3.4% of the total target population. So let's hope that in the remaining 5.5 months, it is able to cover all of its target population. And thanks Shambhavi for providing some insights on vaccine approvals and what are the logistical challenges of it. So thanks Shambhavi for coming to All Things Policy, and thanks to all listeners for listening to the podcast.
Thanks Sunila. Thanks everyone for listening.
If you liked our show, don't forget to check out other interesting podcasts on the IVM network. You can tune into them on the IVM Podcast app, ivmpodcast.com, or wherever you listen to your podcasts. You can also follow IVM on social media. The handle is @IVM Podcasts on Twitter, Facebook, and Instagram. And hey, if you'd like to dive into Taksha research on technology, strategy, and economic affairs, check us out at our Twitter handle @TakshashIlaINST or our website takshashila.org.in.
I hope you enjoyed that show. If you aren't following us on social media, please do. We're IVM Podcast on Twitter, Facebook, and Instagram. Let me quickly thank our sponsors on the network this week. Storytel, thewholetruthfoods.com, and we have a new sponsor in Syed. Thank you all so much for being part of the network. So, this is Valentine's week, and we have a bunch of stuff for you guys. So I'm going to give you a couple of episodes that you could definitely catch up with. Agla Station, Season 2, Episode 12, Be Our Valentine. Ritasha and Ayushi have a little bit of talk about love and all the rest of the stuff that goes wrong with that. On The Habit Coach, episode 396, Ashton Doctor did an episode which went into the much-debated origins of Valentine's Day. Also, do check out Candid Kannan with Siddharth Kannan featuring Govinda and his wife Sunita Ahuja. He talks to them about amazing 33 years together. But you know what, folks? If you want to hear more about these Valentine's Day things, what I suggest is go to our webpage, ivmpodcast.com/blog. And on the blog, we're going to post a bunch of different playlists that we've created for all the various major services. So if you're feeling in the mood for love, do check that out. You'll definitely enjoy it. Just a quick note on a few other noteworthy episodes this week. Nankari Kunal Vijayakar was the guest. They spoke about street food with him. On Simplified, they talk about vaccinating 1 billion people, then the logistical and administrative task in front of us. And on the Wire Talk, Siddharth talks to Devdutt Mukhopadhyay about the human cost of internet shutdowns. And with that, I hope to see you again next week.
Feeling overwhelmed, anxious, struggling with too many obstacles, don't know where your life is headed? Well, if you are dealing with one or all of these, tune into the Positively Unlimited podcast, because in each episode, I share a life lesson, a life hack, a pro tip that can help you get your life back on track. All episodes are available on the IBM website, IBM Podcast app, or wherever it is that you get your podcast from.